Good afternoon, everyone. Welcome back to the Finding Genius video series. I'm joined with Celine Halioua, the founder and CEO of Loyal. Thank you so much for joining us.
Yeah, glad to be here.
Loyal is a biotech startup developing drugs to extend lifespan, and then you're going to go into humans after that, from what I've learned. But Celine was
The
formerly
secret.
the chief of staff to Laura Deming at Longevity Fund, and Loyal recently raised about over $10 million in seed funds from First Round Capital, Box Group, Bedrock Capital, and Collaborative Fund. Um, so this is a topic that's extremely interesting to me, especially when you're thinking about longevity. But I would like to go further back. I know you've written about the topic and have a deep expertise in this. So, as we're thinking about it, could you talk a bit about your background and kind of where your interest in aging and the entire space started coming from?
Yeah, so I actually got into undergrad for art school. I had a full ride to go do painting. And then for some reason that I honestly have no idea why, I decided to do an internship at a neuro-oncology clinic in Germany the summer before I started. I'm half German, hence the German thing. And I met a bunch of patients with terminal brain cancer. And I don't know, it's just something I hadn't realized before that point in my life. I had a very specific moment where I met a patient where I remember asking a doctor, okay, can we do chemotherapy? Can we do radiotherapy? Can we do surgical resection? Can we do a therapeutic? It was just no, 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 no. And at this person, I realized that this person in front of me was going to die. And there was nothing anybody could do. And it didn't matter how much money or time or effort or care you put into it. They were just done. And I just had always thought of, medicine as magic and there's no kind of inescapable fate. And I just in a second realized that wasn't true. And though, in my opinion, almost don't have free will because of these diseases. So I totally freaked out. I had an existential crisis and I switched from art school to neuroscience. I picked neuro because neuro has a lot of open questions. It's in the first class, they're telling you, yeah, we don't know X, Y, and Z, but here's a broad scope. I thought that was an interesting problem to work on. So I've spent 4 years doing research. And I got into aging because I got really interested, in addition to neuro-oncology, in Parkinson's disease, which is a neurodegenerative disorder. Basically, it's age-related. It's a loss of a certain subset of neurons in your brain. They just degenerate and die over time, and it causes this eventually terminal disease that takes a long time to kind of ride out, and is very terrible for the patient. Um, and we were thinking about the lab I was working with, still therapeutics, but they were just I just kind of so the way neurons work is basically the neurons that you were born with are generally speaking the ones that you have for your entire life. There's big asterisk there, but let's just take that assumption, right? Um, and then they're not just cells that sit next to each other. They're all interacting with each other, right? They all kind of touch each other. Synapse is the actual word, with each other, and so it's kind
Right.
of overlapping. It's like wiring overlapping. So when a neuron dies, you can't just go and put the neuron back or replace the neuron, because that's one half of the problem. The other half of the problem is how do you replace the wiring? And I just kind of came to the conclusion while I was working in that lab that replacing the wiring, I'm sure one day will be possible, but it was just such a hard biological problem. And I was like, okay, well, how do we just prevent this from occurring in the first place? So long story short, I learned about the aging thesis, which I'm happy to go into in a sec. And the fact that it seemed to me the most plausible way to develop a preventive mechanism and medicine for the diseases like this. So I totally switched to that and have been working on aging in various ways ever since. And kind of my whole thing has always been how to help accelerate the first ever aging drug approval. And it was first on the healthcare side, and then it was on the venture side, and then got the idea for Loyal, and I thought that made most sense. So now it's on the company building side.
Interesting. And so, when you think about it, given there's been large pharmacy companies, doctors, kind of a lot of money thrown at this problem in the past. How were you when you were building that thesis of what you're saying? Where did that begin to form of saying, okay, I have a new approach to this problem that everybody else either has gotten wrong or there hasn't been enough energy or money thrown towards the problem? Or how do you think about it in terms of you're starting a company now in a white space?
Yeah, so I think there's two things. One is just the general aging space. The aging space should be broader than the oncology drug development space, right? Because it, in theory, encompasses the majority of oncology. It doesn't encompass, pediatric and
Right.
other non-age related cancers, but majority of cancers are age related. So it encompasses all of that, plus neurodegenerative disorders, osteoarthritis, pain, sarcopenia, memory loss, all these things, right? So in theory, the aging field should be absolutely massive. In practice, there's probably like 25 legit companies working on aging in general. And there's a lot of reasons for that that I'm happy to go into. It might take 5 years, but basically, there's just not a lot of people who are like really cognizant of the thesis of aging. And even me, like when I heard about the aging thesis, it took me 2 years to actually have conviction. This is a field I wanted to work on. And I think it's because a lot of it, people conflate the idea of aging drugs and aging mechanism preventative medicines with like immortality and 1,000-year-old humans and we're gonna live to
Yeah.
150 and like
Right.
all these things that like you're like, ugh, like I don't know if I want to live to 1,000. I don't know if it's ethical for rich people in America to live to 150. When like that's realistically like cart way before the damn horse. Like the cart is like in another country with all of those arguments, right? And realistically, what an aging drug actually is right now, at least the first gen aging drugs, is an all-cause preventive medicine or multi-cause preventive medicine for age-related diseases, which is totally non-controversial, like completely
Right. Right.
non-controversial.
Right.
But I think just a lot of people haven't like dove into aging because of that, and the field has a bit of a sketchy reputation in general because of like
Sure.
all of those narratives. So that's one half. The other half is the dog thing, which, by the way, I did not come up with like the whole like dogs are good model of aging thing. For
Right.
example, University of Washington, Matt Kaberlein and his collaborators have been running a dog aging project for quite a few years now. The idea that I basically had is that I wanted to figure out how to set a I basically was like trying to figure out how can we get the first ever aging drug approved, but also get the general public excited about aging drugs and like maybe some like public pressure. The thesis being that like if we had aging drugs for dogs, would that like make easier the path to having aging drugs for people? First, from like a scientific standpoint, from a regulatory standpoint, also just from like a social standpoint, right? Like if you socialize an idea in a animal where it's like less controversial, where like nobody really like questions whether it's a
Yeah.
good thing if your dog lives a longer, healthier life, right? Like dogs are
Right.
just like pure goodness on four legs. Could that help, teach people about the concept of aging drugs, of preventative medicine, drugs for age-related diseases, which would then that's actually like very influential in impacting policy and what like a government prioritizes in funding and in development. Um,
Interesting.
so yeah, that was kind of there's two ways. If I was a billionaire, I would have just gone straight to human, but not a billionaire, so I'm not doing
Right.
that.
Right. And what was so before we get to and how it's taking shape in dogs and kind of what you're working with on the policy side and the scientific side, what was your experience at Longevity Fund and thinking about the problem and the thesis formation, or what you were seeing the 20 or so handful companies that you mentioned of where they may have been going wrong or what they were focused on? Were they focused on humans right away, and that's why you said, okay, no, dogs is actually the right play to start?
Yes, I mean, to be clear, I think all these companies are very complementary. I'm, for example, not developing novel chemical matter, which means there's not going to be a commercial incentive to develop any of the drugs that we're working on for humans. So there's
Okay.
nobody is going to develop those for people. You might do like a POC, like human study,
Right.
but what we might do is like like build a business that's like VC scale, whatever, for dogs. Facilitate us developing new molecules, but also hopefully facilitate these other companies who are developing new chemical matter from day one into actually getting their drugs, if they're efficacious, approved for aging itself and not just some like random indication, which is what the majority of these companies have to do right now. Um, I see it as like very collaborative, and I think a lot of the aging field does too, because it's like it's still really fragile, the field, right? Like if there's a bunch of big failures in the aging companies, I think the entire field will go dormant for another 10 or
Right.
15 years.
Interesting. And so, can you
So
give us a sense of what is your, maybe we should start with when you did go out to fundraise, what was that process like? Because you've had some really interesting thoughts on that you've shared publicly. But
yeah.
even like, what does your day to day look like? Of what was promised or communicated in this seed round of what you wanted to accomplish or what the big objectives look like for you? How did people perceive that? And then is that when you're working on it on your own, or I don't know if you have a team now, but what does that look like on a day to day of when you're solving this big problem? This isn't just an enterprise SaaS company.
Yeah.
So it'd be interesting to hear.
Yeah, so I guess to give a little bit of context, I raised we raised 11 in total, and I raised the first like 5 point whatever 4 3 something like that, um, in January 2020, and it was just me and a pitch deck and literally nothing else. And then we did another 5 after COVID hit because everybody thought the economy was going to go like that. And I was like, great, I
Right.
don't want my company to die because of COVID. So I took another
Yeah.
5 million.
Yeah. Right. Right.
And then we've been going since then. So actually, basically, the company, the like directionality of the company has been the exact same since day one. So what I basically pitched was first ever drugs for aging, bridging to people, consumer friendly pharma, which is the other half of this, right? So like the idea that you could build like a D2C brand, dog owner friendly brand, etc. Around a pharmaceutical product. So that actually is why we have a lot of consumer investors because that's the thing that I transparently need the most help with. Like the biology, like I can handle that, or I can hire people who can handle that.
Yeah.
But the consumer side is a lot more, for me, kind of opaque. And I've learned a lot more since then. Some of my original decks were so terribly ugly. But yeah, the direction has like never changed. And that's because I thought about the thesis a lot. Like I thought about this for like a year and a half, like almost full time longevity fund before like actually starting the company. However, the minutia, the details of how I was going to do it, how I talked, and all the things, that's all changed a ton. Like the initial
Right.
concept was gene therapy for aging in dogs, which like doesn't, at least for our specific use case, doesn't make any sense. Um, but I didn't know that, right? I honestly was just a bias because the lab I came from in Oxford was a gene therapy lab, so I was like prone to think about the problem that way. But then I hired a team, and they're like, "That's stupid for X, Y, and Z reasons." I was like, "Great, well, thank you for telling me." And
Yeah.
then we did other things. So basically, like the execution has, I guess, like crystallized into what it should be, but the thesis never changed. And I think it's like a really interesting problem actually, because it's like there would have been 1,000 reasons to pass on us in the seed because of like me having the technical minutia at that point wrong.
Right.
But at least like I don't know, I feel confident saying this. We've executed very well so far. Like it could all like fall apart tomorrow, but like to
Yeah.
time now, we've executed very well. And so it was really more of like a bet on like the general thesis, and then I guess me. Um, and so maybe my like seed investors are just geniuses and like we're like, well, I think Celine will figure it out, or maybe they just didn't realize that my initial thesis was wrong. Like I have no idea. It was probably some mix
Yeah.
of the two. Uh,
And
but
can you share a bit
yeah.
about that execution if you are saying you execute well without sharing too many secrets, but what does execution look like on a day-to-day basis for you, or what sort of milestones are you trying to hit?
Yeah, so we're basically the way to think about bio is you just try to. Oh, this is my Wolfie. You want to say hi? This is my dog Wolfie.
Oh,
It's all for
nice.
her.
Yeah.
Uh, so execution in bio is often just like de-risking variables. So what
Okay.
we're trying to do is just de-risk various aspects of our drug program. So again, when we started, it was a general idea, but didn't really have anything specific. I knew one of the things I wanted to work on was the large dog, small lifespan dimorphism. So the bigger a dog is, the shorter the lifespan is. And from a Chihuahua to a Great Dane, you have a 2x lifespan differential, which is like super intense. And you don't see that in any other species.
Right.
And it's a consequence of inbreeding and it's genetic in nature, which generally means it's druggable, or it's like a little bit easier to drug than like some random heterogeneous, disease phenotype where you have no idea what started it from day one, right? So I knew I wanted to work on that. But what execution really looked like for us was first like building a really good team. So I'm actually like a pretty hands-off leader. Like I'm very strict's the wrong word. I'm like intense about like how we think about problems and how fast we execute. And we're definitely working on longevity, not working anything else but longevity and like interesting ideas and smart people. But I'm not intense on like the actual mechanism.
Okay.
So like we have people who lead the science, we have people who lead the manufacturing, computational bio, reg, things like that. And like they really have like carte blanche to do whatever they think is best. They obviously have to like talk to me about it, right? But
Right.
like our Michael, our VP of R&D, like he could kill our lead drug program tomorrow. And if he thought that was like a scientifically viable decision and like the best decision, I'm not going to counter him on it because he has decades more scientific experience than I do. And that's actually been a really good, at least at this stage of the company, like really good like execution strategy because we've moved faster and like made better decisions. And I just like am not emotionally attached to literally anything in the company besides good thinking and developing a drug that extends dog lifespan. And I think like it's pretty obvious to me that like there is a drug out there that will extend dog lifespan. So
Right.
really it's more of like us finding it before we die.
That's fascinating.
And then
Right.
turning it into a product.
That's really interesting. Could you talk a bit about the bio IT culture in the Bay Area or kind of what you've experienced while
Yeah,
you're building this?
it's so it's funny. So majority of biotech companies are built in the East Coast. It's often so you don't usually have a CEO like me. The whole like dropout, young, like early 20s, like that like is not a thing in biotech in the
Right.
slightest. The anti signal, the negative signal. I get Elizabeth Holmes jokes all the time because of it, daily. I mean, they might not actually be jokes. Just kidding, just kidding.
It's good.
Um,
Good.
they and it's because like most of biotech is kind of done in these like incubator models. So you have these venture funds where they invest huge amounts of money, like 50 million, 100 million plus. They take majority ownership. They usually like if there's not a like professional CEO in, if professional CEO gets involved, a professional team gets involved. It's usually not the founders of the company who end up actually like leading the company. And of course, this is broad brush. There's exceptions to everything, but it's not really. They don't really have this like cult of the founder, youth wonderkin culture in bio as much as they do in tech. So it's actually been a massively good recruiting strategy for us because there's a lot of people. It's also just like more conservative in general. There's a lot of people who work at these like, big pharmas and or like bio companies in general, and they're just like tired of the culture. Like they're tired of the
Yeah.
bureaucracy. They're tired of the politicking. They're tired of like they're not ever going to move up because their CV is never going to have that Harvard MBA on it, so they're never going to be an exec. Um, and then I come and I'm like, hey, like, I explicitly and implicitly make it very clear that I'm not thinking about building a biotech in any of the ways that like it's been thought about previously. And of course, there's some like West Coast style biotechs in SF, but there's way less,
Right.
not
Right.
that many.
Right.
So
Right.
there's like a few of us, and we all tell this story, and it's actually like very compelling to a certain subset person who like wants to work on ambitious problems and doesn't want to deal with like the corporate
Interesting.
BS.
Yeah. Yeah. Interesting. And could you talk about a bit about you shared some thoughts on it on Twitter, but your process of fundraising, your conversations with Greg Rosen early on, kind of activating investors behind this mission, and kind of what that process has been like.
Yeah, so so something I think is really important, and I am, by the way, everybody when they give like advice on what they think pattern or doesn't pattern to like being a good founder, they're always just patterning to themselves. So like giant asterisk, like everything I'm about to say. But I think it's really important, and like one thing I look for when I talk to other founders is like being like mission motivated first, and then trying like being agnostic to the tool by which they do it almost. And not being just like driven to build a company for the sake of building a company. Like I've met a lot of people who are just like, I want to start a company. I want to be a founder. And like, there are definitely examples of that working, but I've not seen nearly as many. And I was definitely the latter where I knew I wanted to work on aging, but I didn't actually think I wanted to leave VC. So I was the funny story with like the incipients of Loyal at that point called Celebrity was I was a camping trip and I was just like kind of drunk because I didn't know anybody. It was like I don't know, it was like pretty early on in SF. I just moved. And I was joking about how I need to make dogs live longer and like come to me, like I'll make your dog live longer, and like all this BS, right? And there was an investor there who told an investor who told an investor, that was Greg. And Greg was like, oh, I want to talk to this person, and then asked to meet me. So we just grabbed coffees over the summer, and it solidified. He helped me think through the story, da 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 da. But like, don't tell him. Oh, I guess now he can know. I've gone far enough. I
Yeah.
didn't actually decide to start Loyal until I basically signed a term sheet that he gave me a few months after we started meeting. Like I
Interesting.
remember I met Laura and I was like sitting in a coffee shop and I was like, am I going to commit to doing this right now? Like, this is like
Right.
a 15-year or more. I am deciding this is how I'm going to work on this problem. And honestly, again, like pattern matching to myself, like asterisk, I think that's a good thing to think about, right? Like it's better, like if you don't have some hesitation into like committing to building a company for like 15 years, you probably even thought it through. So yeah, that's like my big anti-pattern match that I think like served me well.
Interesting.
But yeah, after that, then I just went out and raised, and like the other big thing was just like complete naive optimism. Like looking back, I'm like, it's fucking ridiculous that I raised like 5 million of terms I did for an idea. But I was just so optimistic. I was like, of course everybody wants to invest
That's
in this.
right.
It's dog longevity. Like, how
Yeah.
could you not? And I'm like, there's
You're
so
a
many things
terrible
I did in the
person if you
early
say
days.
no to that. Right.
I know there's so many things that look like hiring our VP, who's like this amazing guy, who's like this poached him out of Regeneron, and like he joined as like employee number 3 or 4. And like looking back, I'm like, wow, if you told me today that I had to go hire like a VP, who knows his shit out of a giant pharma with like 4 people and $5 million, I would literally puke. Like I would
Yeah.
puke at that knowledge. But I just didn't care. Like I was just
That's
so like,
amazing.
and like that naive optimism is like, and you have to rate it in. Like in certain
Yeah.
places, right? Like
Right.
scientifically. But it was really helpful, honestly.
And could you talk a bit? I know we're almost running out of time, but like the broad neuroscience space, given that's where your foundational knowledge is in, of what you're seeing, what you're excited about when you were looking at Longevity Fund, Biogen's drug on Alzheimer's, like anything that you want to focus on, but where else beyond Loyal are you seeing the market move, or where other opportunities are right now?
Yeah, I mean, I think a lot about reg and clinical, and I think less about like the early stage stuff as much, honestly. I do think there's a number of companies to be built in aging right now. I think you just have to like, but it's not like I could like list them out. It's more of like an instinct that like the aging field should be a lot larger. And if you assume that there's like, I don't know, X number of billion-dollar cancer companies, like, or billion-dollar cancer acquisitions, there should be at least that number of billion-dollar aging acquisitions. So I think the instinct I have is that big pharma is going to get really interested in aging in 5 to 10 years. They're going to want to buy up companies that want to have an aging team already because there's going to be a race mechanism, right? And
Right,
like building a
right,
team, focusing on it, like having a competency, having an exec who can lead it, that's way harder than Biogen is a great example. Biogen's about to make like what billions per year on this
yeah, right.
Aduhelm,
Things like
which like
55,000, right,
yeah, they're going to make a shit ton of money. If they want to get into aging next, they could build a team, or they could just buy a team for 500 million to $1 billion and a
right,
drug that like may or may not work. So I'm to be clear, this is not an acquisition play. I want to build a pharma, but I
yeah,
think there's going to be a big market for these types of companies in 5 years, and trying to build like a really good like translational aging team, or like train people in aging. So a lot of our team comes from neuroscience backgrounds because I really like the training that gives you, but then we like give them context for aging. We give them a space to think about aging every day, all day. And now they are aging people, right?
interesting,
When
yeah,
they never were that before. So I think there's like a bunch of more companies to be built in that way. And they should be around some like central thesis, but like transparently, I don't think it actually like, as long as you like move forward and build something somewhat of value, I don't think it actually matters.
right.
Um,
And
because
are
there
you
will be this
seeing the
big race.
brewings of those ideas at Loyal as well, like small incubations that folks on your team want to start as part of the Loyal brand, or is it still
I
very
have
hyper
so many
focused?
ideas.
Okay,
Oh my god, no. I am like the opposite of hyper focused. I am like text my investors on the weekend, super anxious because I'm like, oh, there's definitely $1 billion aging company to be built in like X, Y, and Z, and oh my god, I want
right.
to work on this so bad, and then like, no, like seed stage company,
Focus
like
on.
narrow it down, Celine. So and yeah, the team has ideas too. Like we have more ideas than we have money and people, honestly. Um,
Interesting.
so yes, please, more competent people in aging would be fantastic because if we don't start working on this problem now, we're not going to solve it by the time that we need
Right,
it.
right,
So
right. Well, Celine, this is really interesting, really helpful. And I'm looking forward to following along. I'm sure everybody else is, but I appreciate you taking the time.
yep, yep. Thank you.
Yeah.